First of all, I would like to thank Professor Köksal. He touched upon many subjects that I was going to express. Well, let me take you through the agenda. In psychiatry, first of all, I was gonna define VR, the use of VR. And then I was going to talk about virtual reality in psychiatry, trauma disorders, obsessive compulsive disorder, and general information about the use of VR in such disorders. As you all know, virtual reality is trying to emulate normal life and it allows us to interact with computer simulations that represent reality. Since 1950s, VR technology has been used for entertainment purposes, and then video applications were developed and integrated with VR applications. In recent years, as technology evolved, it has been adopted in the field of psychiatry as well. Traditionally, as you all know, exposure therapy has been considered the most effective method of treating anxiety disorders. And if we can integrate our own applications to the VR, data will accumulate. And right now, the most important thing that we know is that anxiety disorders can be most effectively treated by VR. Of course, there are certain stages and shapes. As mentioned by Professor Köksal, the use of evaluation of VR of anxiety disorders, we can be more objective. Objective biosignal data can be used. Let's say imagings and heart rate, blood pressure, galvanic skin response during virtual reality exercise can be measured through wearable devices, and we can understand whether this type of therapy is useful or not. According to certain studies, when it comes to treating some anxiety disorders, VR exposure therapy has proven to be more effective. Of course, once again, I'd like to underline that the perception of people is very important when virtual reality-based techniques are used. When we take a look at the literature, VR is not found as believable, and there is a tendency to rule out the use of VR. VR exposure therapy is investigated in combination with medications in some studies as well, as we know. I will talk about that briefly, especially in recent years. There has been therapeutic studies including psychedelic therapy sessions, psychedelic medications, and they were trying to measure whether including psychedelic therapy to VR is more effective or not. The most important advantage of using VR application is that the applications that are normally costly, the simulations, for instance, war simulations or coping with trauma or fear of flying, can be adjusted thanks to VR applications. Another important advantage is that there are certain stages of stimulation. Therefore, some side effects that may cause harm to the patient can be delayed. Certain mechanisms can be established through harmonization between the patient and the therapist. And VR approaches allow us to try simulations. There are also certain disadvantages of VR applications in psychiatry. Let's say a patient with hypochondria, or let's say there's nausea, headaches, sweating, as well as symptoms of motion sickness. In such cases, some individuals may experience significant discomfort when we apply VR, especially in old studies, animation was being used and people were not taking it realistic, as mentioned by Professor Köksal as well. Right now, studies are mostly conducted with a small sample size. Therefore, it is a bit early for us to make assumptions and conclusive assumptions. I also want to touch upon the use of VR in social anxiety disorder. Social anxiety disorder is a psychiatric condition in which the patient experiences anxiety in social interactions. VR-based interventions for this disorder often involve the use of computer-generated social environments in parallel with the virtual audiences. Real environments are tried to be simulated. There is a study conducted by Klinger, including 36 patients, and they found similar effects as the use of CBT when they made use of VR therapy. Another study by Bocard found that VR was more effective in social anxiety, but after 6 months, symptoms of social anxiety relapsed. And another study conducted a trial with patients, and the symptoms start to relapse after some time. So, on the picture situated on the right side, you see animation applications, but on the left side, you see real person images. On the one side, there's an animated group, and on the other side, there's real group of people. I think in the future, the use of VR in treating social anxiety disorder will be more successful. As mentioned by Professor Köksal, VR can also be used to make diagnosis, to learn responses of patients, to understand the severity of the social anxiety disorder, and to make observations. It can be used. So this is avatar therapy. This is a picture from avatar therapy. We use it with patients having social anxiety disorder. Some behaviors, such as eye contact, fear of eye contact, can be eliminated with the help of this therapy. Another example is about panic disorder and agoraphobia. Panic disorder and agoraphobia are characterized by the onset of sudden anxiety with physiological and cognitive symptoms, and with the help of exposure therapy, such symptoms can be reduced. The number of studies conducted on this field is very low, but in the last decade there have been an increase. In the following 9 months of the treatment, in the 9 months of follow-up, the results were seen as stable. As I mentioned before, regarding treating agoraphobia treatment, we allow patients to roam around open spaces and we measure their heart rates to evaluate their symptoms. Specific phobias are also tried to be treated with VR. The first application was conducted in 1995 against phobia, insect phobia, spider phobia, and then different factors such as stagings and different levels. It was understood that VR proved to be very successful in treating specific phobias, especially if phobia of flying was also treated with the help of VR in a very successful manner. Well, very beautiful images can be created with the help of VR, and they can be put into practice. We can also support the use of VR with the use of antidepressant such as yohimbine or hydrochloride. We try to understand their impact, and we used a small sample size. Yohimbine and propranolol medications were added to the equation, and we didn't see a significant difference between using medications and VR. The most important thing when it comes to agoraphobia, the fear of height, we can make use of different animations simulating real-life environments. There are some special clinics in Turkey making use of this technology. Well, most of what I touched upon are only successful applications. There have been other studies as well, but most of their findings, even if they were positive, they are not 100% clear whether they are effective against anxiety disorder. There are also other exercises such as breathing exercises that can be used in parallel with VR therapy. But as I mentioned before, it's not possible for us to make conclusive assumptions. Especially after 13 sessions of VR therapy applied to Vietnam veterans, the PTSD symptoms were seen to be diminished. And finally, I would like to talk about the use of VR in obsessive compulsive disorder. In obsessive compulsive disorder treatment, we have to be able to identify responses and symptoms of the patients. And for this aim, we are making use of VR for diagnostic purposes. The authors in a study found that patients with controlling behavior had a higher frequency of checking. And other than this, for patients with obsessive compulsive disorder, studies with small sample size were conducted, contamination with people having contamination. In the year 2020, another study was conducted by a group of researchers in Hacettepe, including 21 participants with a high fear of contamination, and they received 3 sessions of VR response prevention therapy, and they were shown to experience less anxiety and disgust and a reduced urge to wash their hands after the therapy. In conclusion, we can confidently say that it is generally accepted. It takes about 20 years from the publication of a study to become widely used, and anxiety disorder findings show us the effectiveness of the use of VR. Virtual reality has emerged as a viable tool to help with a variety of disorders, including anxiety disorder, and I believe that the use of VR therapies for patients with anxiety disorders will increase in time. Thank you very much.